Okay, so we're assessing children with autism. Okay, so what is autism? Autism is a complex neurobehavioral condition that includes impairments in social interaction and development, language, and communication skills combined with rigid, repetitive behaviors. Because of the range of symptoms, the condition is now called Autism Spectrum Disorder, ASD. It covers a large spectrum of symptoms, skills, and levels of impairment. And right here in the picture, it shows like the 3 core autism symptoms, like social deficits, language impairment, and repetitive behaviors. Since it's a large spectrum of symptoms, there are like several different types, like clearly shown in the picture.
Alright, so caring for a child with autism may present many challenges for an EMS responder because every situation, every child is different. They say once you've met one child with autism, you've just met one child with autism. And many of these behaviors can be mistaken for altered mental status, such as a lack of communication, delay or lack of total response, repetitive motor mannerisms, if they're like flapping their hands or fingers, inappropriate attachments to inanimate objects, lack of like awareness of the environment, if they're easily stimulated by lights and sirens, laughing or crying when it's inappropriate, just lots of different symptoms that will raise awareness for a EMS provider, but really it's just due to the autism of the child, not necessarily their altered mental state.
Okay, so here are some tips for EMS when they're approaching an autistic child. So the first thing you want to do is avoid lights and sirens when possible because they're hypersensitive and so it'll freak them out a little bit. And then you want to limit the number of caregivers and locate the key individual to the patient so the patient can better understand what's happening to them. Provide direct requests using simple language. If you can say, "Can you move over here?" The autistic patient may not understand you, so then you're going to want to ask them to please move over here. And then when you transport the patient, consider the response autistic individuals may have to the safety straps on the stretcher. Explain the purpose of the straps before putting them on. Inform the receiving faculty of the patient's diagnosis. A hallway bed may be unbearable for the autistic patient. Be sure to communicate any specific approaches that have been proven successful with your patient. Allow the patient to perform self-stimulating activities unless it would other compromise care. These activities may be the patient's way of calming and comforting themselves. Remember, the autistic patient may be hyper or hyposensitive to tactile stimuli. EKG patches, tape, or gauze pads may be added discomfort to them. Oral medications may be especially repugnant to them. Consider using pediatric medication for adults when possible. Assess for pain. Recognize autistic individuals may not respond to commonly used instruments such as the Wong-Baker faces pain rating scale due to their inability to read facial expressions. Commonly used modulates used to reveal pain such as hot-cold therapy may be tolerated by the individual.